Time now for Morning Rounds, our look at the medical news of the week. And this week, the Food and Drug Administration approved the first treatment specifically targeting postpartum depression.
It's a condition that can impact women following childbirth, sometimes even starting during pregnancy. Symptoms can include sadness, loss of energy, and feelings of guilt and worthlessness. Here to discuss this and more is CBS News medical contributor Dr. David Agus. Good morning.
Morning.
This is a condition that you can only truly understand unless you've been through it.
Right.
Tell us about this new drug.
So 1 in 9 women have this condition. The number one cause of death after childbirth is suicide. So this is a real problem. This is a drug, Zulresso, that's given by intravenous infusion over 60 hours. So you have to be admitted to a certain hospital. There's certain specified hospitals that can do this. You basically have to leave your child for 60 hours and go for this $34,000, but it works. It's a derivative of progesterone, a natural hormone that can very quickly reverse the depression. And then patients can go on a medicine, the standard medicines we have, that take weeks to work. The argument is you don't want to wait weeks with this postpartum depression. You want it immediate, and that's what this drug did. So it's exciting, except it's more common in people of lower socioeconomic class, exactly who won't be able to afford this drug. So while exciting scientific advance, I'm a little bit worried about the implementation.
I didn't realize it was so common, and I also didn't know that there was no treatment really until now. Why is that the case, and do you think this will open the door to other treatments?
Well, I think, we have drugs that work for depression. They just take a long time to work. And this is one where you need something immediate to bond with the child, to take care of the child. And obviously, we didn't have one. It's always difficult to develop drugs when you have a woman who may be breastfeeding, when you have somebody after a condition like pregnancy. And so there's been reticence to do it. Now I think there's going to be a need for an oral one that acts immediately by the same mechanism, and that's under development now. So I think that'll be the really big advance because it should be applicable to the masses.
All right. Next up, low-dose aspirin. For years, the small pill has been hailed as a preventive measure for heart attack and stroke. But in a reversal, newly updated cardiovascular health guidelines from the American College of Cardiology say low-dose aspirin is not recommended for people who are in good health and without certain risk factors. David, you've done a lot of research on aspirin. What's your takeaway from these guidelines?
So this is controversial. I have gotten so many emails this week. I'm literally, my inbox is overloaded. Every single person, what do I do? What do I do? So here is the bottom line. The reversal did not happen in most people.
Right.
The study that came out more recently showed that if you were over 70 and had not been on aspirin and started it in a period of follow-up of about 5 years, no real benefit in heart disease or on cancer. Well, the cancer benefit, we don't start till around year 6. And these people hadn't been on it at the age we say you should start it, which is earlier. So 40 or 50, you have a 10% chance or risk of significant heart disease, you should be on it. If you have a family history of cancer, you should be on it. So myself, I have a family history of heart disease and cancer. I am on a baby aspirin a day that I started at age 40. So in most people, the recommendations haven't changed. The big caveat is aspirin can cause bleeding. So if you have any risk factors for bleeding, you shouldn't be on it. But you should sit down with your doctor and say, hey, what's my risk for heart disease, cancer? And based on that, go on this very simple preventive mechanism that by blocking inflammation has a dramatic effect on disease.
All right, finally, for many stroke survivors, basic arm movements can be a real challenge. Now, researchers at Northwestern University are showing how gaming might be able to assist. A small group participated in the study playing a customized video game where specific muscles controlled the on-screen movements. This sounds promising.
I love how there's a can of A&W root beer in the picture. That's Chicago.
Hey, I live in Chicago.
Oh, I love Chicago, don't get me wrong. This is tremendous and very exciting, is that they're basically teaching you to control the muscles in your arm through video gaming, and it worked. And so it's a real hope for people and some of these people that had stroke and couldn't move for long periods of time, and they regained some function. So I think it's really exciting that they're taking people with a debilitating condition and giving them a chance and hope to really recover some of their function.
Dr. David Agus, thank you so much. That is exciting.